Let me state from the outset that it is disheartening that while the Minister of Health, under the guidance of His Excellency President Edgar Lungu, has been working tirelessly to restore the confidence of our partners and indeed the Zambian people in the health system, some unscrupulous individuals who work in our health institutions have been taking advantage of the very people that we seek to save to enrich their own pockets. Immediate disciplinary action has been taken against the two individuals identified from a recent media expose by MUVI TV at the University Teaching Hospital, one of whom is already in police custody. Those who are illegally collecting money from patients for COVID-19 tests or for any other activity in the hospitals who will not condone them. And I want to thank MUVI TV for your role, in making sure that you serve as watchdogs in society. And I urge the public to make sure that you watch over all these abuses and report them quickly as they happen. We have also restructured our testing facility at the University Teaching Hospital outpatient department. We will not allow the image of the ministry or indeed the health sector to be tarnished by a few bad eggs. Internal investigations have also been instituted, extending to several departments at the University Teaching Hospital to identify the full extent of these dishonest dealings. We are also working to ensure that our whistleblower channels continue to encourage members of the public to come forward in such circumstances. We're in the business of saving lives, not taking advantage of our people or indeed our patients. So let this serve as a stern warning to all would-be offenders around the country in all health facilities, the Ministry of Health, headquarters, and statutory bodies, that no bad eggs will be spared. We will take stern disciplinary action against all culprits, including instant dismissal as provided for under the public service. Allow me to stress once more that all our dealings at every level must be done with total accountability, transparency, and integrity. We are closing all leaking taps and loopholes because we don't want any pilferage of resources, be they drugs, medical supplies, or finances meant for the public. As part of the COVID-19 response, we have continued to ensure commodity security through provision of essential commodities, including personal protective equipment and oxygen cylinders to our facilities around the country. In line with our commitment to ensuring that we safeguard the interests of the public, I also wish to commend the Zambia Medicines Regulatory Authority, ZAMRA, for the action taken against the manufacturers of PHT. There's a tea which was being purported as a cure for COVID-19. So I want to thank ZAMRA for the action taken against these manufacturers of the PHT. And these are unverified so-called COVID-19 cures. And ZAMRA has taken action by closing the facilities of these people who are duping our country, our people. Ladies and gentlemen, there is no cure for COVID-19. Do not be deceived by people who are only out to defraud you of your hard-earned money. I also wish to commend ZAMRA for intervening in Eastern Province against pharmaceutical outlets that were trading in ivermectin, another purported cure of COVID-19, which is actually mostly used in veterinary medicine in animals. I wish to note that according to a report provided by ZAMRA, there has been a reduction in the importation of ivermectin for human use, and that ZAMRA is closely monitoring and engaging with pharmaceutical outlets to ensure that the drug is only used for its intended purpose. Consultations with our colleagues in veterinary medicine have indicated the high use of the drug during this period, and which has correlated with the current increase in parasitic infections in animals.